Dr. David Amron, this is your Lippy Q of the week. Dr. Amron, how many surgeries do you do on average for full treatment? Okay, so the quick answer to that is 2 on average. But let me go into a little more detail about that. So, it is on average 2. It rarely is 1 for full treatment, although it can be in certain patients. It can go into a 3rd surgery in larger patients or more extensive lipedema, and very rarely in like large 450-pound stage 4 lipolymphedema patients, it can go into something like a 4th surgery. I look at this, and we've talked about this a lot, in terms of cosmetic units and groupings and treatment plans, and you should refer back to those segments on that. But I also think in terms of full surgeries and partial surgeries, typically half a surgery. So let me just explain that a little bit. So with your average patient with lipedema, stage 2, stage 3, calves and ankles, all the way up to the groin and the outer buttock area involved, circumferentially, and the upper arms, that's a grouping of 2 surgeries. Calves and ankles together with the upper arms as 1 full surgery, and circumferential thighs and outer buttock area completely bilaterally as a 2nd full surgery a month or more apart. If somebody has pelvic girdle involvement, that becomes what I call a half a surgery with things. I may actually shift things around. I may do pelvic girdle to decompress proximally along with calves and ankles as a full surgery, and circumferential thighs as a full surgery, and then finally the upper arms become a half a surgery, 2 days apart from a full surgery. That's a 2.5 surgery plan. Somebody might be a full 3 surgery plan. So if somebody has calves, ankles, thighs, arms, maybe even forearms too, and has the torso involved, the central admin can occur in some patients with lipedema, or we're doing it for cosmetic reasons, hip, upper buttock area. I may do a full 3 surgery plan on that patient because you're doing basically your entire body. Circumferential torso, hip, upper buttocks in typically the 1st surgery to decongest proximally first. Then I'll generally go to calves, ankles, and upper arms in the 2nd surgery. And then finally the 3rd surgery is another full surgery, circumferential thighs. And the forearms can typically be done with the upper arms too. So that's a full 3 surgery plan. Sometimes the patient may only have involvements in their calves and ankles and their lower medial thigh and knee area, and they don't really have much involvement, which is less common in their upper thigh area. And we're trying to strategize in terms of how few surgeries can we do this in and get a great improvement. I may be able to do that person in a 1 surgery plan with it. So again, it's a long discussion. I evaluate every person in terms of a treatment plan, strategically how I'm doing it, the number of surgeries, and hopefully that answers the question.